reduced activity. So we can't generalize on the basis of what we see in South Africa. We need to understand that in the rest of the world there are enough there's enough evidence to show that this AstraZeneca is still very effective. I had a long discussion with AstraZeneca leadership. Again, we've got a common understanding that in South Africa what we need to do is to do a kind of study that will help us to get more information and reduce the levels of uncertainty about the effectiveness of the vaccine. Beyond that, we should then continue with the other vaccines. Now, having said so, all the vaccines, like in the next one that's coming with Pfizer, we will also make sure that in the process we do a kind of implementation study so that we can have the same kind of observation that we'll be getting on the J&J vaccine. We want to thank all our health workers. At the level of enthusiasm from our health workers is unbelievable. I do a count, and this morning the count had gone past 400,000 who have registered for vaccination. So the number is increasing much faster. So it gives me a good opportunity to go back to the manufacturers and say, guys, listen, please let's match this, because we can see the level of enthusiasm. In fact, our approach is that we hope that we can expand the capacity in such a way that we can vaccinate as many as those are available, so that we can actually start the phase 2 earlier. Because when I go out there and I talk to people, the numbers of people who are very keen to join in are quite a lot. Now this time around, who we were going to vaccinate was the president. We requested for a special clearance for the president because not because president says he's a health worker by marriage, but because it's a very important statement coming from the head of state that this is what you do. This is safe for our people. Have taken it, and please go on, because it's leading from the front, it's leading by example. And in this case, now I grew up with traditional healers. If a traditional healer in the African context, you don't give somebody something that you're not ready to take yourself. And this for me is a major message to say, President has been vaccinated, Zweli Mkhize has also taken the vaccine. The Deputy Minister will take the vaccine, the MECs will take the vaccine. So when they stand up in front of us and say, take the vaccine, they'll start by saying, I've already been vaccinated. Yeah. It's a very important message to reassure our people, because there's too much of concern, anxiety, lots of fake news, lots of concern that come from factual reports in various countries about what has happened in a number of countries where vaccination has taken place. I just want to say we have enough scientific expertise to be able to detect anything that could be a risk to our people, and we will act before anybody is harmed if there is any sort. So we have made sure that we bring the vaccines because their safety have been established, their efficacy have been established, but also their impact on our environment has somehow been tested, even though in different ways. So we will never be observing all of that. But President has now led us by example, and of course, I'm aware that most of the professors are going to be falling onto line. They will be getting themselves vaccinated. Doctors, nurses, general workers are going to be vaccinated, and also, excuse me, and also the trade union leaders who are themselves ready to be vaccinated, but also all health workers. So that for me is a kind of united effort that I want to appreciate from our health workers, our trade unions, our administrators, our researchers, our professors, our academics, all of us united together in this kind of effort. So we are therefore going on with this campaign, and hopefully, we also got a team to look at what else can be done to accelerate the process so that more and more people can be vaccinated. That, I think, covers most of the questions that have been asked, unless there's one. What's your question?
No, but it was about the other members of the cabinet that were vaccinated.
Sorry?
It was about the other members of the cabinet. You mentioned MECs and professors. Who exactly is going to be vaccinated?
No, most of those will come in onto the next batch. Phase 2, most of the cabinet will come on phase 2. Most of the leaders, religious leaders, traditional leaders, artists and musicians and so on, influential people in those particular different categories, they're all ready. Taxis, transport and so on, they're all ready to come in the next phase. So the slight difference, there are constraints in this one that it was defined in the protocol, which is allowing us to do the numbers that we're doing, because we said priority is health workers. Then the rest are going to be phase 2, where we're looking for various categories of our workers to be participating, as well as ensuring that those who lead in those categories must appear in the forefront. So we'll deal with them in that way. Then at the moment, the approach we're going to be saying, we will vaccinate as many South Africans as possible and as many of the people in South Africa as possible. So that will be the approach we're going to take. Obviously, there's a whole lot of registration process that has to be taken into account as you go in through that. So that's our approach that we're going to take. So at the end of the day, we want to limit the numbers of people who are vulnerable to COVID-19 so that they don't become a pool that will spread the infection in our country.
Okay. Thank you. I think just to give Minister time to drink water, I want to introduce the first person to be vaccinated. So that we can also ask questions. Today we're according to there's supposed to be about 13. So the first 5 that were vaccinated, because we have to bring all the categories. So I wanted to introduce you to them. With the clinicians, I've got professional nurse. Where's doctor? Because I'm going to give you the opportunity. And also I've got doctor is here, who's also working here in Khayelitsha. The other categories, I can see them somewhere, they are there. We have to also include the administrators and also the support services from the porters and the clerk. And also I've got the EMS, and also I've got the private from the Melomed currently, so that to showcase in terms of the equitable access in regard to when we talk about the healthcare workers. So I want to give the opportunity for the 2 that are next to me just to say something. How do they feel? If there are any side effects yet? And all of those. Professional nurse, Mamtua, and then after that, the specialist. Thank you. Now they can you use this? Which one? Keep on changing. Okay. Few minutes.
Okay. I'm Sister Josie. I'm the frontliner. I'm the first nurse who received the vaccination in KDH today.
First person.
First person in the Western Cape.
Western Cape. Yes. At the moment, I don't feel anything.
First person in the country. Oh, in the country!
At the present moment, I don't feel anything. I'm still Zoliswa. No side effects. Yes. I'm still okay.
How did you feel about doing it?
At first, I was nervous. But yeah, I was happy.
Who selected you as the first?
I think it's my manager, Sister Woni, because she told me that I would be the first.
And you were happy?
Yes, I was happy.
How does your family feel about you getting vaccinated?
No, they were happy because I told my husband yesterday, but today I didn't spoke to him. No, it's hurting, but a bit. Not much.
Thank you, Your Honor.
Okay.
Don't be scared. Don't be scared.
Hi everyone, thanks so much for coming. My name is Saad Lari. I'm an emergency physician here at Khayelitsha Hospital. And I'd like to say that I actually feel very blessed to get the vaccine. I feel great. I feel great physically. Actually, I don't even have pain in my arm. I think it's because sister gave such a good shot. But yeah, I actually feel blessed, that I think, after all our hard work and effort in the first and the second wave, that we finally have another layer of protection, another tool in our armamentarium in the fight against COVID-19. I'd like to make a proposal, if I may. It's just an idea that the vaccine be called hope. And it's hope that, that this pandemic ends. And it's hope that the country recovers from all the death and all the destruction and all the diseases going on. And it's also hope that the economy recovers so that everybody can get back to our livelihoods. And I'd just like to thank, all my fellow colleagues and admin staff and healthcare workers who've been every day at work, fighting, and even the guys who deliver oxygen, And I also don't want to forget our administrators, and they've put in long hours, and I know many of them have not even slept. There's too many people to thank, and actually also we have to be able to thank our politicians.